Welcome to Vance and Lee's lab.
Huskies.
We have some special guests with us, Travis and Macy. So we're gonna start by doing some transfer techniques, okay?
Read the.
Macy, will you please give the honors of reading of the special guests?
Ruby Cleary is an 82-year-old female recently admitted after fracturing her hip and undergoing right hip replacement surgery. A dressing change has just been completed. Assist Mrs. Cleary into a chair using proper body mechanics and transfer technique. Mrs. Cleary has been up in a chair on a few occasions and has tolerated it well. No other caregiver has been required. Document your care in the EHR.
Thank you, Macy.
Okay, jump in that bed and let's start.
Here we go. Yeah, let's do this. Listen slower.
No, it doesn't raise. You need that. No, you have to raise the
No,
bed.
that
It
doesn't work.
Yeah, they were just working on that one. I don't know if it's working.
Oh, okay. Go over
Let's
here.
do the-
But you don't want to
That's high enough. That's high
you
enough.
want to make sure you have to lower it.
Yeah.
And then you want to put it up into high power. So usually they'll have the patient laying down.
Yeah, right. So lay down.
Lay down. You just text me?
Okay, so the first thing that you're going to do before you don't have your wheelchair by the bedside yet. Come out here. You're outside the room. Okay, so here, kind of follow along and state it.
So, I'm going to verify the activity order in the EHR, and I'm going to gather my supplies, which include a transfer belt and a wheelchair, and then I'm going to perform hand hygiene. And then I'm going to walk in, introduce myself, identify the patient with 2 identifiers, and explain what's going on. Hi, Mrs. Cleary. How are you today?
Good.
Good. All right. My name is Macy, and I'm gonna be the one that's helping you move. Okay?
Okay.
And we're just gonna get you into this chair. And can I get your name and date of birth, please?
Thanks, long on 2092.
Perfect. So next, I'm going to
Muscle strength, mobility,
now I'm going to ask them
Here, you
assess
can
their
center.
muscle strength.
or hold it for her.
There's different ways I can do that.
I would have them squeeze your hands, yeah.
Can you squeeze my hands? Pull against me.
Pull you under the bed.
Okay, and now how about your feet? Can you go ahead and push up? Alrighty, and can you move your hip or your legs? How many discs? How many?
Checking joint mobility as
Okay.
well. Active tolerance to asking.
Was that painful for you? Ask him. You can be in it. Ask him if it was painful, if he had any
Was
discomfort.
that any pain, or is there any pain with that?
No, not at all.
Alrighty.
And then cognitive.
And do you know what day it is?
Yeah, it's Thursday.
And do you know where you are?
The hospital.
Alright. So I would then lower the bed. It's already hard. And I'm going to.
Before you move him, though, you have to do a set of.
Oh, I do?
And a set of vitals.
Should I verbalize that?
Yeah, just pretend like you're doing it now.
Then I would take your vitals, and your pulse, and your respirations. Pulse is 72, and respirations are 18. I would do your blood pressure. Blood pressure is 120 over 80. Temperature is 98.6.
Oxygen
Your
saturation.
oxygen, 98% on room air. And I already talked about the other.
And you're also going to assess for risk.
Okay.
Fall risk.
Yeah.
So, patient likely has a fall risk because she has a broken hip and needs assistance when transferring. Okay. Then I'm going to lower the bed, right?
So what side is the strong side?
This left side is strong.
Her under hip, she had right hip, so left is.
Yep.
Our position is here.
Oh.
Actually, we'd rather do it over there. That this works.
Oh.
Right? Yeah. Alright. Then I'm going to move the bed into 5 hours. Where's the mask? Oh, right here.
Make sure you put the brakes on.
Hair locks.
Now,
Talk about a shear sore.
Of the wheelchair. Of the wheelchair.
Oh, these breaks.
Yeah.
Next, I'll help sit you up, okay?
Okay.
That works. Alright, so we'll move you. How about you sit up?
No, so you're going to have the patient bend their knees and roll to their side. And roll to the side.
For the camera, mainly.
And then have them push up with their hand.
Alright, push up
And
with
you
your
assist
hand.
them. That hand down there.
Like this?
Yes.
And then I'm just gonna.
Wait, I don't need this.
Your left hand.
You're pushing up, so you're
Or-
sitting up.
Like this?
Yes, and then hang your feet off the
Oh, I
edge.
think you go like this.
I don't even know.
Yes, and then
Okay.
push up with your
And then
hand.
push up.
Yeah, and then I'll.
Oh.
I don't even know.
Oh my gosh.
I'm gonna pull your wheelchair closer, and I'm going to put on the transfer belt.
Because I
Do what you will.
had a
So make sure that when patient is sitting up, you are supporting the patient with a firm base.
Oh, when I stand them up.
When you sit them up and when you stand them up.
Oh.
But when they're sitting up, you need to.
I think you have it on backwards.
right there.
Yeah.
They start to like.
You have it on
We'll have a
backwards.
patient that's like this, and then 5 seconds later they're like laying down.
Yeah. And then you also want to assist that patient has what on their feet.
Non-slip shoes or something.
Good.
And then. Okay. Are you ready? So next I'm going to put my knee in between their knees.
On the outside of the weak leg, and then.
Right here.
So
Just
spreads
strong leg.
spreads feet apart, flexes knees, and aligns knees with patient's knees. There you go. Grasps gait belt and rocks 1, 2.
So on the count of 3, we're going to stand up, okay?
Okay.
So we're going to rock forward. 1, 2, 3.
Did they tell you about how their arms should be?
Around your neck or your shoulders.
So I grab you like this, and you're gonna grab like the backs of my
Oh,
arms.
okay.
So you're like
Like
no,
this?
like this.
Oh, like this.
Yeah, like that,
Okay.
and that'll
Okay.
stabilize it.
Okay.
I was kind of not. I was just gonna sit there. Let you do it.
So I'm going
And
to
then they can like kind of they
Yeah.
can use you as a base, but they can use their own. I'm just.
Okay.
It makes it easier on you and your back. So.
So I'm going to when I lift you up then and we start to shuffle over, you're gonna want to use your grab onto these.
Okay.
To help
Patient
lower
will
yourself
pivot
into-
on the strong leg. Instruct the patient how to.
You're going to pivot on your strong leg.
Okay.
Okay? Ready? 1, 2. Oh wait, no, pivot on your strong leg. You can take a couple steps. There you go. And now lower yourself down. Very good.
Thanks, Macy.
How you feeling?
Good.
Okay.
Perform hand hygiene. And document in the EHR. And Vance is going to a party.